Hello, good morning, my fellow friends. So today, me, Laini Rajak, and our one and only Bangsha, Mr. Muhammad Saifullah, are going to present or explain to you all about the barium enema, one of the barium enema series. It's a Hampton view, also known as a butterfly view. So for this projection, we are going to use the bigger size cassette that we always use in our department, which is 30 times 35 cm cassette, and of course the general X-ray machine. Okay, now let's set up our tube. Okay, for the tube, we have to rotate the tube to counter to get the 30-degree countered angulation. And then now we can put our cassette to the bucky, table bucky in a lengthwise orientation. Okay, now let's set up the exposure factor in our control panel. So for this projection, exposure factor, it's actually depend on what type of contrast media that we use. Okay, if we use the single contrast, we give 100 to 125 kV.
So before we start the examination, first of all, make sure we do the right patient, check the ID patient, the RN patient, and make sure the patient that we want to do is a right patient. Okay, and then the patient must change to the hospital gown. Make sure there's no radio bag like necklace or belt or pants, and it's necessary to patient to change to the hospital gown. When the patient have already done change from the to the hospital gown, the patient will lie down on the table examination. Okay, for patient positioning, patient must in prone position. Okay, so the patient is lie down on the prone position, and make sure MSP of the patient is aligned with the long edges of the table. Okay, we pull up a bit of leg, and make sure both of the hand must away from the body, or exactly away from the region of abdomen. Make sure the pelvis, there's no rotation at the pelvis. You can palpate the ASIS is equal distance to the table examination. Then make sure the patient is close to the table of IR and centering to the level of iliac crest. Make sure the centering is equal to the center of the IR. Then give the instruction to the patient to breathe in, breathe out, and hold it for a while. When everything has been done, so before the exposure has been exposed, give the patient instruction to breathe in, breathe out, and breathe in, breathe out, and hold it for a while, and the exposure, and expose the exposure. When you expose the exposure, look at the patient, and then when done, give the instruction for patient to breathe normally. When everything has been done, ask patient to change the clothes to their own clothes. So that's all for Hampton View. Thank you. Bye bye.